bit about who we are at the California Center for Public Health Advocacy. We are a statewide nonprofit organization established in 1999. We have locations in Northern and Southern California and also provide technical assistance on a national scale. We work to promote the effective public policy and health options both at the state and local level. And we develop policy briefs, disseminate different fact sheets, and share research with a broader audience. We also support policy development in many jurisdictions, both in LA County and statewide. We also track state policy and provide technical assistance to various cities and counties around health and wellness, really encouraging local entities to provide healthy options for families. And our objective for today is to share strategies that have worked, share data, share evidence-based strategies that have provided healthier food and beverage options for families, and in some cases in under-resourced communities as well. So we want to provide, share the landscape for you this morning, and also share some lessons learned from San Fernando and the County of Los Angeles. We also want to discuss the challenges because, as many of us know, it's not always easy making the healthy choice, the easy choice. When we are faced with several challenges, we will share that with you today, and are also open to follow-up questions, and we're open to providing additional resources as we work through the webinar. So we will be reviewing the evidence that supports increasing access to healthier food and beverages. And we have a wonderful panel for you this morning. These are our health champions that CCPHA has continued to work with. We have Andrea Giancoli, Nutrition Policy Consultant and Spokesperson for the Academy of Nutrition and Dietetics. Ismael Aguila, who's Recreation and Community Services Manager for the City of San Fernando, and one of the first cities in LA County to adopt a nutrition standards policy. And we have Michelle Wood, Program Manager for Los Angeles County Department of Public Health, Choose Health LA. So just a few housekeeping issues. Feel free to ask questions, and you can submit your questions on the questions panel, and we will be answering questions at the end. So make sure that you're writing your questions as you're following along on the webinar. We also want to remind you that today's presentation will be recorded. And again, CCPHA will be available for follow-up questions if we run out of time, or if you have additional information that you need from us. We are available, and we will share our email information at the end of the webinar. So once again, thank you for joining, and we will begin with our first presenter, Andrea Giancoli. She is a registered dietitian, nutrition advocate, consultant, and communicator, and is the current national media spokesperson for the Academy of Nutrition and Dietetics, providing nutrition expertise to television, radio, internet, print media. She's also been on television, the NBC's Today Show, Access Hollywood. So as you can see, Andrea is an expert and is really called upon by various entities to share her knowledge. Andrea has been a nutrition policy consultant with the California Center for Public Health Advocacy for close to 10 years, and we're excited that she's able to join us this morning. Welcome, Andrea.
Thank you very much, Jeanette. I appreciate that introduction. What I'd like to talk about today is why we need to increase access to healthier food and beverages, a little bit of the evidence surrounding that. And I'd like to make this presentation a little bit interactive and ask you a few questions along the way to get some of your participation. But first, let's talk a little bit about how we got to where we are. In the United States, we are seeing an obesity epidemic. And on the slides you're seeing before you right now, probably many of you have seen these slides already, but some of you have not. But I always like to bring them up again just to illustrate what the United States is experiencing right now in terms of the increases in obesity. This first slide is from 1990, and as you can see from the slide, the states with the darkest blue had 10 to 14% obesity, When we move forward to 1995, next slide, please, you see that there are no longer any light blue slides, and we've had to add another color of 15 to 19% obesity in parts of the country with the darkest blue states. And then moving on to year 2000, we only have one light blue state that is left with a 10 to 14% obesity, which used to be the highest rate of obesity in the United States. Now we've moved on to states that have more than 20%. Going on to 2005, again, we change all of our colors, and we only have one still, Colorado, with 15 to 19% obesity. And then we have a couple of new colors with 25 to 29% obesity, and then three states that have over 30% obesity. 2010, now you see there's no blue slides at all, and there are no states that have less than 20% obesity, and many states that have over 30% obesity in adults. And unfortunately, we see from this particular slide, just the colors show you how much the United States obesity has increased over the years. And we're even seeing that among our children in the United States. Over the past 30 years, childhood obesity has tripled. And if we look at what's happening in California, you can see that overweight and obesity is happening here as well. And I'm sure that's not a surprise to anyone. But when we look at the California Health Interview survey results, what we see here is the rates of overweight and obesity in several counties. And some of you are on the line right now. And we've added a few to show you kind of what the magnitude of the problem is here in California. As for our kids, in 2010, we took a look at the fitness gram and gathered data about overweight and obesity among our children. And as you can see, many of the counties have more than a third of their children are considered overweight or obese. The total for California is 38%. So we ask ourselves, what is happening? Well, a lot of things are happening. There's many reasons why we're experiencing the obesity epidemic, but we can certainly take a look at the availability of food. I mean, junk food is everywhere. It's certainly marketed to us. It's certainly available. And there is ample access to a lot of food in our society. And unfortunately, we are in an environment where we are hardwired to crave fat, sugar, and salt. And this environment that we currently live in has exploded really in terms of food availability over the last couple of decades. We really haven't been able to keep up with evolution, and because we are hardwired to crave all these kinds of foods, we eat them. So let's take a look at what exactly we are eating and what we ought to be eating. Well, we're definitely a population, human beings, they like their sugar intake, but a little bit of sugar is okay. And the American Heart Association has even set recommendations for how much sugar we should be consuming every day. For men, it is 9 teaspoons of added sugar, which is around 150 calories. For women, 6 teaspoons, around 100 calories. And for children, 3 teaspoons, around 50 calories. And let me just be clear that I'm talking about added sugar intake, not the natural sugars that are found in fruits and milks and things of that nature. So what I would like to ask you today is, given that we know what the daily recommendations are for how many teaspoons of sugar men, women, and children should consume, what do you think is the average daily intake of teaspoons of added sugar that Americans are intaking? Now, if you will please, we're going to put a poll. Oh, I see some of you are okay. Looks like we have most of our poll in. Thank you for voting. I'll give you guys a second. And it looks like you all are very familiar, either familiar with this data or are very good guessers. The answer is 22.2. And that is about 355 calories of added sugar a day. So if we look at how much sugar in terms of calories for all of our age groups, for our children and adolescents, you can see our boys are consuming almost 442 calories of sugar a day in their adolescence. It really seems to, it's still quite high in our younger children, but it really creeps up as they grow older very consistently. And then if we look at our adults, we can see that in the 20 to 39-year-old, that is the highest in both male and females. And it starts to then go down after we age. So the 20 to 39-year-olds in adults are vulnerable, as well as our adolescents, for intake of added sugars. So what I'd like to ask you next is, where are our calories really coming from? We know we can look at this data and say, okay, we're eating a lot of added sugars, but where is it coming from? So I'd like to ask you to participate in the next poll and see if you can determine where it's coming from. Wow, okay. Let's see, we've almost done with our poll. And it looks like 96% of you chose sugar-sweetened beverages and 4% of you chose desserts. Well, you're absolutely right for adults and adolescents. Next slide, please. In the US, the #1 source of calories for children is desserts. #2 for children is sugar-sweetened beverages. For adolescents, the #1 source of calories is sugar-sweetened beverages. #2 is desserts, and I just put #3 is pizza, just because that's something that we're so accustomed to our kids wanting that it's probably not surprising that pizza is #3. But what I did find surprising is that the #1 source of calories for adults is also sugar-sweetened beverages, and #2 is desserts. So our 1 and 2 sources of calories for children, adolescents, and adults is either sugar-sweetened beverages or desserts. And I'd like to take a look next at how many calories we're really getting from those sugar-sweetened drinks in the United States. And as you can see, our 12 to 19-year-olds and our 20 to 39-year-olds are consuming the most. Although our young kids are still consuming quite a bit, as well as our older adults are. But let's take a look at what's happening in California in our children. In California, 41% of our kids that are 2 to 11 are having 1 or more sugar-sweetened beverages a day. And 62% of our kids age 12 to 17 are having 1 or more sugar-sweetened beverages a day. And that amounts to at least 10 teaspoons of sugar. And as you recall, the recommendation for children is just 3 teaspoons a day. So it's well over the recommendation of added sugar. And the reason why we're so concerned about this is that sugar-sweetened beverages are tied to weight gain. Studies have consistently shown that a higher intake of these kinds of beverages is associated with higher energy intake. And a higher energy intake is associated with weight gain, and that can be related to overweight and obesity. And it's estimated that sugar-sweetened beverages account for 1/5 of the weight that was gained in the United States between 1977 and 2007. Now, in addition to the weight bias that overweight and obese individuals experience, we have to be very sensitive to that. But we're very concerned about their health because overweight and obesity increase the risk for diabetes, heart disease, cancers, and many other conditions and ailments. And we have to be very clear that we are trying to combat this problem to improve the health of our nation and to improve the health of California. So next slide, please. As we've already shown, some of the reasons to focus on sugar-sweetened beverages They're linked to overweight and obesity. We see that they're consumed excessively. They have very few, if any, nutritional benefits at all. They offer poor calorie compensation. And what we mean by that is when you consume a sugar-sweetened beverage that's, say, 150 calories or 250 calories, such as what we find in a 20-ounce regular soda, we don't make up for it later by eating less in regular food. So it can actually add on top of all of our regular calories, and that's how it can contribute to weight gain. We're also very concerned about dental decay because essentially these sugar-sweetened beverages are sugar water that are bathing our teeth and our children's teeth and potentially promoting dental caries. Also, it's the food that's most marketed to children, and we're very concerned about that because our children are vulnerable. And of course, it's not just marketed to children, but it's also marketed to everyone. You see billboards, you see vending machines, you see marquees. We're constantly being bombarded with this type of marketing. And what I want to be clear when we talk about sugar-sweetened beverages, we're not just talking about sodas. For a long time, since we've been having this conversation for over 10 years now, people keep saying soda, 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 soda. Well, soda is not the only sugar-sweetened beverage out there that we need to be concerned about. Certainly, it's the one that's most pointed to, but it is not the only one. So in this next poll, I'd like you to see if you can pick out some of the other beverages that are also part of the sugar-sweetened beverage category. Please vote now. Is everyone seeing the poll? Okay, we're getting people voting. Thank you very much for voting. We're almost done. And it looks like the number one, oh, we're not quite done. It looks like the number one choice is energy drinks and sports drinks. Yeah, and you're all correct. All of these drinks, next slide please, are sports drinks like our Gatorades, our Powerades, our iced teas, even our sweetened coffees, and of course our fruit drinks that they have pictures of fruit on them. They look appetizing, they're lovely, they're colorful. They pull us into, and part of that is that we think they're going to be full of fruit and healthful for us. But these sorts of drinks often have little to no juice at all and are sweetened with sugars or sugars. And even our vitamin waters, they have this health halo around them because we're pulled in by the word vitamin and water, and it is a way to have us think that they're full of nutrients and this is something that is good for us. Well, these have usually just as much sugar in them as as a sports drink. And then of course our energy drinks is an interesting name for these beverages because energy is really what calories are. So they're full of calories. And what I want to be clear about is that we're talking about, when I'm speaking of all these beverages, we're talking about the ones that are sweetened with sugars. And it doesn't matter what type of sugars they are. They could be high fructose corn syrup. They could be sugar itself. They could be organic cane syrup. They're all calories that are added and extra. So what can we do about this? Well, what has been happening in California is some cities and counties are working to increase access to healthier beverages, such as eliminating sugar-sweetened beverages, requiring access to safe, free drinking water, and increasing access to bottled water, juices, and milk that can be purchased instead of some of these other sugar-sweetened beverages. And as you can see, this healthy beverages are definitely possible. Again, many of you on the call are already doing this or have already passed nutrition standards that limit or eliminate some of these beverages, and I congratulate all of you because it's something that is clearly a problem in our society and that we need to continue to make progress. Now, we also want to be looking at food. Added sugars aren't just coming from sugar-sweetened beverages, as we saw in the poll, added sugars are also coming from desserts, and they're coming from a lot of snack foods. But we also eat too much, we intake too much saturated fat, trans fat, sodium, and not enough fiber. We're also consuming big portions. So our calories are going up. And we're really hardwired to eat as much as we can and to eat what's in front of us. And when we have a large portion, we tend to eat it or eat as much of it as we can. And that can be detrimental to our health and to our weight. So what can we do? Well, like with beverages, we want to try to increase our access to the healthier choices in addition to offering appropriate portion sizes. And we can offer appropriate portion sizes by limiting the calories. We also want to limit saturated fat, trans fat, and sugar. And while we also want to offer some lower sodium choices. Sodium is an issue in the United States that we certainly consume too much sodium. And because we are so accustomed to high levels of sodium, it's been a difficult nutrient to attack because once you take sodium out of the food, it loses flavor. So we need to do this gradually and try to offer some lower sodium choices while continuing to change that incrementally. And it's important that we emphasize, of course, fruits, vegetables, whole grains, low fat or non-fat dairy products, and provide some higher fiber choices. And it's very important that this is important for all types of food, but especially important for snacks because snacking has increased in the United States, and increased snacking is associated with increased calorie intake. And of course, increased calorie intake increases our risk for weight gain and thus the potential for health problems. And when we make these kinds of choices, we have a lot in our environment that needs fixing, but we're working on it incrementally. As you can see, with some of the standards that some of you cities and some of the counties have implemented with nutrition standards in their programs and facilities and in other venues, we've gotten rid of the worst of the worst. We've gotten rid of the giant candy bar and replaced it with a granola bar. We've gotten rid of the pork rinds and replaced it with pretzels. So again, we're not necessarily making everything the healthiest that it could be, but it's definitely much better than it could be. And healthier food options in vending machines and in cafeterias are possible. And I know that Michelle Wood later on is going to speak to you a little bit about what's going on in the cafeterias in Los Angeles County, and Ishmael is going to be speaking about what they've done in San Fernando with their vending machines. And I'd like to end with a quote from the Institute of Medicine, given that we have this environment that is really pushing us to eat more food. It is unreasonable to expect that people will change their behavior easily when so many forces in the social, cultural, and physical environment conspire against such change. And we can address that through public policy, which many of you are doing. And I'd like to acknowledge all the cities and all the counties in California that have thus far set nutrition standards in their facilities, in their programs, and their meetings. This accounts for not just their public facilities, but also for their facilities where staff are, etc. And California Center for Public Health Advocacy has a template of a model policy that you can find on their website at publichealthadvocacy.org. And cities in California who are part of the California Health Initiative have also set standards that are by Public Health Institute. So there are plenty of resources that you can go to for these nutrition standards. And for those of you that have already set them, I'm going to hand it back over to Jeanette so that she can introduce the next two panelists who will speak about what the implementation process has been like for them. Thank you.
Great. Thank you, Andrea. And I always learn something new when I hear you present. So thank you for sharing the information. I also want to acknowledge the city of Baldwin Park. That was actually the first city to pass a nutrition standards policy in 2003. And really the leadership there came from the city council, from Councilwoman Marlene Garcia, from entities like Kaiser Permanente and the city of Baldwin Park. So I want to acknowledge the city of Baldwin Park. So as we continue to work here in LA County, we worked with cities to encourage them to provide healthier options, not only in venues where children congregate, but citywide. And our messaging to local elected officials is really to make the healthy choice, the easy choice, to encourage a city to use public dollars for public good. And when we first approached the city of San Fernando, we just received a warm welcome from Mr. Ismael Aguila, who is a health advocate and a health champion, and we are excited that he's joining us today. And I'd like to share a little bit about Ismael. He, for the past 17 years, he has provided leadership for several health management teams in the public and private sectors. This includes the Department of Public Health for the County of Los Angeles, Network for a Healthy California, and the Orange County Fire Authority. Ismael has designed and implemented innovative community health programs that have received national recognition by the American Public Health Association and the White House. And he also created Los Angeles County's first ever physical activity initiative. And San Fernando works to provide healthier options, not only in vending machines, but I know Ismael has worked diligently to ensure that their summer programming has healthier options. There's a health and wellness element that they're working toward. So really, this is an effort that encompasses all facets of the city of San Fernando. So we're excited to hear about Ismael's experience with not only nutrition standards, but also implementing health and wellness. So we're excited to have you here today. And I'd like to introduce Ismael Aguila.
Thank you. Thank you. I really do appreciate all those kind words. To give you a little bit of background here at the city of San Fernando, basically back in November of 7th, 2007, the city did adopt a healthy food and beverage policy, but prior to that there were some wheels in motion that helped that get to that point. But in 2010, the city adopted a healthy eating, active living city campaign and declared itself as a California healthy city and community. And then in July of 2011, the Parks Commission has been working with was working with California Center for Public Health Advocacy and recommended that health food policy be taken to the City Council, and eventually so we went through the whole channels to go from the department to the commission to a standing committee, eventually to City Council for it to finally get passed in November of 2011. The policy applies to all vending machines in the city-owned public facilities. So there are 3 parks. One is a multi-million regional pool facility, City Hall, and Police Department. And again, all the snacks in all those vending machines do meet all the guidelines listed in SB 12 and the beverages for the SB 965. However, because of some of our regional pool facility houses quite a bit of athletes, and we spoke with many of the coaches from those swim clubs and schools regarding this policy, and they were very concerned that they still need some high caloric type of drinks and or snacks for their athletes. Sometimes they would arrive with nothing in hand, and I'll talk a little bit about that in barriers. But that's basically what the policy was. Some of the barriers that we experienced was we're just really unsure about the public reaction. I think that would probably be a concern for everyone. I mean, we are a public entity here. Staff concerns. As I started bringing this up in executive meetings, some of my fellow staff showed some concerns, including our city administrator at that time, about their choice of freedom and the losing that freedom to choose what they want. And also the concern that they need their caffeine rush or their sugar rush, and that would inhibit them from getting all their work done. There's also concerns for loss of revenue for our vendors. We are a small city. We do have a lot of small local businesses, small businesses. So it was very concerned to make sure that that there was no loss in revenue for them, especially our snack vendor, who is a local resident here in the city of San Fernando, and also his business is housed here in the city of San Fernando. And our city facilities, cater both to active and sedentary populations. And again, I mentioned the pool facility, and it housing several lots of athletes. And actually, this last year for the Olympic pre-qualifying, I think there were about 5 swimmers actually from some of the swim clubs that were actually in the qualifiers that train out of our pool. And I think the other barrier that we're kind of forgetting here was, the city was definitely lacking a lot of funding and staffing. We're currently still dealing with approximately a $5.5 million deficit. The last 5-6 years, staffing has been pretty much cut 50%. Yet the programming, at least for this department, has remained roughly around the same. So staff was spread pretty thin. So to get anything done would be almost impossible, especially if you want to take on an initiative like this policy. Which brings us to the next slide, which is the support systems. I think this is the key to success. You got to get buy-in from your stakeholders. You got to get those technical partners, and you definitely got to get buy-in from the community. City of San Fernando had council members that clearly were very supportive of any health initiative, including our parks commissioners. We had a lot of technical assistance and support from Dr. Stephen Loy at California State University Northridge. He has I always say he has an army of physical activity specialists that help us implement programs here at our city. But he also put us in contact with the nutrition department and the public health department at Northridge to bring in individuals and students to help us conduct some of the educational seminars that we implemented for this. And clearly, California Center for Public Health Advocacy played a huge role, and probably the largest role out of all of them, as they did provide us with education, technical assistance. They gave us staff reports. They told us what best practices, what was being done in other cities. Clearly, without them, we could not have done that. And I think the last one that is to consider is definitely the vendors. The vendors had to be on board, especially with a small city. And it was getting them on board that really helped us make this smooth transition. Implementation. Again, this policy was adopted back in November 2011. Immediately, we contacted our vendors to discuss the new policy, but we were already in conversation with them before, let them know that this was most likely going to happen. I know our snack vendor was extremely supportive at the end. At the beginning, he was not. I remember the first conversation I had with him, and he was very hesitant. In fact, I think I actually think he wanted to take a swing at me there for a moment there, but because he knew this would impact his lifestyle and his income. But as time went on, as we continued to talk, I provided him a lot of information about the benefits, and and a lot of information was given to me by California Center for Public Health Advocacy. And by the end, I remember there was actually an aha moment where the vendor actually said, "You know what? I get it. I remember how many times I went to go fill a vending machine, and how I'd always see a child begging his mom to give him money to buy some candy." And it was at that moment he realized that how powerful food is to children, and how he is affecting that, and how he could make a change here. And by offering healthier options, now the kid hopefully would be begging for something that'd be healthier versus that really high sweet or high fat or high caloric snack. So once we got him on board, it made it easier. Our beverage vendor was Coca-Cola. They're a local. They're local here in San Fernando, so they've been with us for years. They also said that it's no problem. This is something trend they see coming, and they've already had several healthy options, so they had no resistance whatsoever. California Center for Public Health Advocacy did provide us with snack lists and other resources that we can utilize to educate our vendors. That was really key, but we had to take it to another level because our snack vendor was a sole proprietor. He had no staff to help him implement this. So we actually grabbed the snack list and actually, so what he would do is he'd bring us in new snacks that he thought would qualify, and I'd have the staff calculate it for him, and that made it much easier. And then we kept a list of everything that he brought to us in that passed, and we utilized that to go back to verify to make sure that those are the only items that he was selling. And we also signed new contracts with all the vendors. After that, we did meet with city staff to discuss the communication plan, and bottom line, it was communicated to the staff and also to the public regarding this. And what was unique about what happened here in the city of San Fernando is right about this time when this got passed in November is when there was the incident at one of our council meetings where a mayor made a few comments regarding his personal life and what him actually dating another council member, and that created a lot of intense anger with residents and media. So for the next year, a lot of that was going on, and so our communication plan didn't go out as we wanted it to happen. Our goal was to make sure that we provided literature to all of our programs and to the parents in all of our programs that we offered, and we did. And we had assist there from California Center for Public Health Advocacy and the universities. But as far as communicating to staff, that didn't happen as much as we would like to have happened. But I think there was a lot of distraction going on, so we didn't get to do that as much. And of course, after we implemented that was to track and report. The goal was implement this by March of 2012, which is approximately 4.5 months after it originally was passed at the City Council. One of the biggest concerns, as I had personally, clearly was with our vendors, and the next slide kind of shows you what happened. If you look at the blue line, you can see what the revenues were, the gross revenues for, and this is just for the snack machine. I was not able to get access to the beverage machines, but you can see that if you look at the blue line, if you look at the number 3, that would be March. So March, we're looking at revenues of roughly about $2,300, and you see about 17% decrease the very following month, going to about $1,900. But then you go back to March of 2012, a year after, for March, our revenues were actually about $2,600, close to $2,700, and then the policy took into effect on March 30th. You can see the outcome, what happened in April, how it jumped, or actually how it decreased about over almost 55% decrease in sales. And I remember after that, the vendor was very concerned. But as you can see, in about 2 to 3 months later, we were pretty much back at what he was doing initially, and actually kind of went up a little bit for the summer. The only change he made was a 5% increase in costs. So most items went up by about 5 cents. This is about what they went up. For the most part, the way we did it here in San Fernando was we wanted to be conventional. We wanted to do a lot of outreach, asked for the implementation, and we did. However, we did have kind of a unique situation, a lot of hoopla going on for those 12 months, which eventually ended up having the 3 council members recalled. But the success right now has been that, I mean, we've had nothing but positive feedback from the vending machines. I think there might have been in that year and a half maybe one individual who actually said something and was more just caught surprised. But for the most part, I think the feedback we've been getting has been positive from the parents and even from our day camp kids. No one has really said anything, with the exception of why are they charging $1.25 for a bottle of water? Why isn't it $1? Why isn't it 50 cents? So more just the cost, and that's about it. So I'll just turn it over from there.
Great, thank you, Ismael. Great information. Definitely a model for other folks to follow, and we appreciate the information that you shared. And also sticking with this policy despite some challenges that you were facing in your city. So we appreciate your leadership. So at this time, we want to go ahead and do a physical activity break. So if everyone will go ahead and stand up, go ahead and stretch, reach for the sky, reach up, reach high, touch your toes. So we just want to make sure that everyone is awake, engaged, excited, and go ahead and drink your water. Move your body. Yeah, move your body for just a couple more seconds, and then we'll go ahead and start just a couple more seconds. So. Okay, great. So we will continue with our next presenter that will provide an overview and really share the model that LA County is currently following, which is great. Michelle Wood is Program Manager for Food Procurement and Policy for the Los Angeles County Department of Public Health, Choose Health LA Initiative, an obesity prevention program funded through the Centers for Disease Control and Prevention. Michelle leads efforts to improve nutrition in food service environments and promote healthy eating in Los Angeles County school districts, the County of LA government facilities, and other food service venues. And Michelle is also a member of the Los Angeles Food Policy Council's Good Food Purchasing Technical Advisory Committee, helping support the implementation of the Good Food Purchasing Guidelines in food service institutions, including the City of Los Angeles departments. So I will go ahead and turn it over to Michelle.
Thanks, Jeanette, and I want to thank CCPHA for having me on today. And I'm really excited to share some of the work that's happening here in LA County to increase access to healthier food and beverages. So I thought I would do a couple things today. First, share LA County's experience with operationalizing nutrition standards and other procurement practices in our government departments and some of our programs. And then second, present some early lessons learned and some preliminary evaluation findings of our broader food procurement initiative here in the county. So I thought I'd sort of step back and look, sort of define what healthy food procurement is. I think most folks on the call know that governments buy food to provide meals to dependent populations such as jails or school districts or senior meals in their communities, and they also purchase food to sell to employees in the public in retail outlets. And governments will often contract out their purchasing of their food, and they typically use a competitive solicitation process to purchase food. And it's within this process that we can build nutrition into an institution's contractual and or operational process through integrating nutrition standards, food purchasing standards, and environmental approaches. Broadly, I think most folks know nutrition standards refer to codified limits for calories or sodium. Food purchasing standards are requirements that adhere to these nutrient limits, but usually include other institutional considerations such as locally grown food. And environmental strategies or approaches include those strategies that we can implement in our government facilities to increase selection and consumption of healthier foods, such as calorie postings, placing products, at eye level, or integrating signage to increase selection. So what are the broader goals of creating healthier food environments? First and foremost, increasing access to healthy food and beverages, improving nutritional quality, leveraging the purchasing power of large institutions. For example, here in the County of LA government, we have the opportunity of impacting approximately 37 million meals per year. Additionally, supporting local economies by encouraging the purchasing of locally grown food, and then most importantly, improving the broader health of employees and community members who use our government programs and our facilities. So I thought I'd give you some context on how we began our initiative here in the County of LA government. Back in 2009, the Department of Public Health conducted a needs assessment which explored the facilitators and barriers of a proposed food procurement policy, which would require food services and vendors in the county to meet nutrition standards. Specifically, this paper looked at sodium consumption. And interviews were conducted with our county departments that purchase, distribute, and sell food. And we learned a few things. The first thing is we learned that serving nutritious food was a higher priority for our county departments. And then second, that organizations have the authority to impose nutrition standards within their government facilities. We also learned departments shared some specific challenges that they may face. First, that there's a huge range of food service venues in our county department, and they're all very complex, and they all have unique features of each of their food service arrangements. Additionally, there's a variance in the knowledge and experience in operationalizing nutrition standards, specifically even looking at sodium. So to help overcome these barriers, most of our county departments recommended working to adopt department-specific or venue-based nutrition standards moving forward. And these two papers that you see on this slide really helped inform how we approached, how we really sort of built the foundation of our work moving forward with our county departments. So the next slide, so as part of this assessment, we also learned that there's hundreds of worksite food service venues within county departments, including our cafeterias and snack shops and vending machines. And in many of these venues, including these specific venues, patrons are often residents of nearby low-income neighborhoods. And these are actually some pictures of some of our food environments in the county government. We also learned the estimated reach. I already mentioned 37 million meals per year. And as you can see on the slide, our institutionalized populations within our jails, which is administered by our county sheriff's department, serve approximately 80,000 meals per day. So it's a huge amount of meals per day. So back in 2010, we first began to work with our Department of Health Services and our county hospital system to integrate healthy food procurement within their vending machines and their cafeterias. And this really laid a strong foundation for our work moving forward. In 2011, we worked with our Board of Supervisors in the 2nd District, Mark Ridley Thomas's office, to provide technical assistance on drafting language for a board motion, which would require all of our county departments to consult with the Department of Public Health for all county food service contracts to ensure dietary requirements would promote healthy nutrition. And this was adopted, as you can see, in March of 2011. And changes to food service contracts would be made as contracts are renewed, and the adoption of nutrition recommendations to the extent feasible with each department. So following the adoption of this motion, we formed a broader advisory committee, and actually California Center for Public Health Advocacy is an active member of this advisory committee. And as you can see, we have a lot of the other key associations and health partners around the county who are involved in this work. So based on the lessons learned from the 2009 assessment that I discussed earlier and looking to implement the board motion, we developed a department-specific or venue-based approach. And this approach targets departmental food service contracts. And I'm going to talk in the next slide about that contracting process. But as we work to review these food service contracts, part of this process is reviewing current food standards, policies, and practices of each food service institution. And then from there, identifying areas where improvements can be made and develop evidence-based nutrition recommendations to each county department. And once those are integrated into the food service contract, our department provides technical assistance to departments, including nutrition technical advice, as well as monitoring and evaluation. And I'm not sure if folks on the call, some of you may have been able to participate in our annual food policy forum, which was a few weeks ago. We've convened that forum 3 years in a row, and that really in an effort to share best practices and lessons learned from local, state, and federal partners who are doing this work in the community. So this slide basically shows, it's a flow chart of our approach on how we integrate nutrition standards in food service contracts. And starting from the left, you can see if you're, an example would be if you're, our hospital system, for example, in the county is looking to specify what it's purchasing for patient meals or for cafeteria meals or for their vending machines. They'll specify what they're wanting to purchase through either an RFP or an invitation for a bid, a request for a proposal or an invitation for bid. And it's within these documents that we can actually provide, Department of Public Health recommends nutrition standards and healthy food purchasing practices to be integrated into those solicitations. And then once that's complete, the solicitation will include the specified nutrient limits and other environmental approaches. And then proposers will submit plans on how they will meet this criteria. Typically, contracts are negotiated, and then a new vendor is chosen with that new commitment to provide access to healthier food and beverages within that specific food environment. So following the adoption of the board motion, we had to step back and begin to understand, what kind of environments did we have in the county. So we actually did a very broad-based food service assessment, and we interviewed 15 of our 37 departments in the county, and we conducted interviews with food service directors and dietitians and key stakeholders within each of those departments. Some of the interview topics that we covered to really better understand those environments included the types of venues that we have, their locations, profiles of customers served. Are these seniors? Are these children that we're serving? Food preparation, contracting processes, the number of meals and the snacks that are offered and sold, and then of course looking at the current nutrition-related standards or guidelines that each of the departments are working under if they're already regulated, for example, our jails or our probation camps. So what we learned through this assessment is we have 12 departments who purchase, sell, or distribute food. We have 101,000 employees in the county, and 12 out of our departments actually purchase, distribute, or sell food. And you can see the stars, the yellow and the red stars represent those departments in the county who actually have food programs. And these are the types of venues that are impacted by our county's board motion. And as you can see, we have retail environments, worksite cafeterias and concession operations, and on the top, jails, juvenile detention centers, so our institutionalized populations, and then distributed food programs. We offer 2 different senior meal programs, and we have our after-school snack program at our parks. We have mobile vending, mobile food trucks, and then we have vending machines across the county as well that some of our departments administer. So over the last 3 years, we've been able to work with 5 of our county departments in multiple venues impacting hundreds of locations. As you can see, we work with our Health Services Department, our Public Works Department, Probations, Parks and Recs, and our Chief Executive Office. Predominantly in our retail environments. As you can see, we've worked a lot in cafeterias, vending machines, and then we also worked with our probations department on the meals that are being offered and served in our camps and our halls. And then we most recently worked with our parks department on improving the nutritional content of food being offered in the USDA's Summer Food Service and after-school snack program. And we are planning to work with 2 more departments in the next 3 to 4 months, our Beaches and Harbors Department and then our Parks and Recreation Department on another food setting that they administer. So I thought I'd give you a sort of a case study of one of the departments that we've been working with over the last 2 years. Back in 2010, we began to work with our Department of Public Works. Right following the adoption of the board motion, one of their contracts actually had come up for renewal. They have a cafeteria in their headquarters building in Alhambra, and that's on site, and there's a picture. And they also have vending machines in throughout their building, and the building in Alhambra actually has 1,500 employees that can access this cafeteria and the vending machines that are on site. So this gives you sort of a sample of some of the nutrition standards as well as environmental strategies that we were able to integrate into the contract that DPW administers there. We were able to integrate healthy entree and side option and snacks, and I didn't include the nutrients, but they have to meet, for example, the entrees have to meet, they have to be under 500 calories and under 600 milligrams of sodium. We also were able to include reduced portion sizes for sugar-sweetened beverages, and then we were also able to integrate language around working with the vendor on gradually reducing sodium, which Andrea actually already referenced earlier in her presentation, encouraging the purchasing of locally grown food, and then and there's a whole other range of standards that I didn't include in here, which if you're wanting to, if you want to learn more about the actual standards, my contact information is at the end of the presentation. We're also able to integrate language around the promotion, signage, menu labeling, and then also ensuring price incentives, so folks actually will select and consume these products. For example, water must be priced equal or lower than other beverages that are offered in the cafeteria. We also worked with the Department of Public Works on integrating our vending machine nutrition policy language within their contract. And that policy actually is a separate policy that was adopted by our Board of Supervisors back in 2006. And we work with their vendor to change the food products within their vending machines in the Alhambra building. So in addition, going beyond sort of the nutrition standards, we also included in contract product placement and promotion strategies, and currently still working with the vendor to implement guidelines such as displaying healthy food and beverage options within 5 feet of all checkout registers in retail environments. You can see there's other strategies we're working with them on, displaying only water, diet drinks, 100% fruit juice or low-fat dairy products in eye-level sections of all beverage cases. And other strategies that we're working with the department on include reducing portion size. So for example, encouraging the use of 10-inch plates or smaller, and then also other strategies around promoting water consumption by providing access to fresh, cold tap water. And you can see these are some of the materials that our department has developed and are actually currently being implemented into the cafeteria. We have table tents that are going to be on all the tables in the facility, promoting a lot of these health tips that you see on this slide. So in addition to sort of implementation efforts, our department has a large evaluation unit that's been working with me closely over the last few years, working to document the potential effectiveness of expanding access to healthier food options for county staff, our clients, and other members of the public. And this gives you sort of a range of some of the activities that we're working on. First, examining compliance with nutrition standards. And that's where a lot of our work has been over the last year. And then working to gauge acceptability of changes to the new menus, and then reviewing inventory of food sold or consumed at our government facilities. And I wanted to give you a little bit of a taste of some of the successes around implementation of the Department of Public Works cafeteria. To date, the vendor has been able to integrate the healthier entree options, which I mentioned earlier. They're also offering side salad or fruit as an alternative side option to French fries or onion rings. They've integrated a beautiful salad bar and have implemented the reduced size portions of sugar-sweetened beverages in the cafeteria. They've also done an amazing job of including nutritional information at point of purchase, and they're currently working to implement signage that our department has developed, which I showed you some of the signage earlier when I mentioned the promotion and product placement slides. They're currently working to integrate those signages in the facility. In addition, they've also been working to change out the vending machines and integrating healthy beverages and snacks in all of the machines in the DPW building in Alhambra. So this slide shows you pre-post. The left shows you the old vendor and prior to the contract being executed with the new vendor that I've been discussing. And on the right side, you can see post-implementation of our nutrition standards. And you can see that the vendor is labeling the healthier choices, so the patron is able to identify those entrees that are meeting our nutrition standards, the 500 calorie and 600 milligram nutrition standards that are in contract. So as I already mentioned, we have also been working with the same facility on implementing our county vending machine nutrition policy. That policy was actually adopted back in 2006, and I can share copies with folks who are interested following the call. We also conducted, our evaluation unit conducted an environmental scan of this facility and using a validated vending machine measurement tool called NEMS-V. And I can share with you that, and this was done about a year ago, so we actually haven't gone back in. We've been working with them trying to improve to get to 100% compliance. But as you can see, before the contract was executed, we were at 41% healthy snacks. And then following adoption, integration of the standards, we doubled our healthy snacks. And then the same thing for our beverage environment. We were at 30% before the implementation of the county nutrition policy. And at this last point when we went into the facility, we were at almost 80% healthy beverages. So huge change in this environment. And as I mentioned, we're currently working with the vendor to change out those last few products to meet 100% compliance of our policy in the county. So over the last year, we've co-authored a handful of papers on our healthy food procurement efforts in the Advances in Nutrition Journal. These are the two of the papers, and these papers really describe the process required to operationalize nutrition standards and share lessons learned to date. And we have a couple other papers that are sort of in the works, looking at our sugar-sweetened beverage campaign, as well as our work around reducing sodium in government facilities. But I wanted to share sort of these two papers if folks are interested in looking at these. So as far as lessons learned, you know, some of the key facilitators that I wanted to share with call participants is, I think the real major key in our work over the last few years, as we have been working with each department, the review of the current procurement practices and then assessing their readiness to be able to operationalize new approaches has been very, very critical. Looking at sort of the current regulatory environment, many of our departments already have to meet pretty rigorous standards. So what's been key is looking at those standards and being able to identify, you know, where can we move from there as far as improving the nutritional content, and then working with the department on, you know, their institutional readiness to move forward on that. Additionally, there's tremendous support around the country in this work, and we've received a lot of great feedback and support and technical support from other state and national partners, including work that's being done by the CDC actually with their GSA, Health and Human Services, nutrition standards that are being implemented in their cafeterias at the federal level. Also have received a lot of guidance from New York City and NSRI, which is their National Sodium Reduction Initiative. Folks may know about that. Strong partnerships, very critical, and developing those partnerships early with our departments and identifying, you know, key champions and key stakeholders within each of these departments for implementation. And then technical assistance. This work is, you know, there's a lot to this work. I think you've heard that from speakers prior to me. And TA has been really critical, and continual TA is very critical to support ongoing implementation, as well as monitoring and compliance and collecting that, you know, revenue and sales data that you've already heard about earlier today. So what have been some of the barriers and challenges? Each institution, we have a lot of food environments within the county, and each institution has its own internal administrative processes, each has its own contracts divisions, and each has its own unique needs and concerns. And we heard early on through that 2009 assessment that I shared earlier in my presentation that it was critical for us to develop venue-based recommendations. Many jurisdictions around the country are moving forward on sort of a universal set of standards, and we heard early on from our departments that they really wanted to work with us on developing very department-specific venue-based strategies, and I think that's been working for us. It's kind of meeting where each department is and looking at their costs and their feasibility, and being able to work with them individually has been very helpful. There's also a huge variance among departments' understanding of nutrition and nutrition concepts, and you know, what is sodium and how do we drop sodium? And so huge variance. Some departments have dietitians, some don't have dietitians. So that's been a challenge. And then concerns, of course, about cost and availability and acceptability of healthier food options, And another challenge has been around just collecting data. And one recommendation I can share with the call participants is building that into your contract, and so that you're ensuring that sort of there's an expectation that you can collect that data has been very helpful for our county efforts here. So I wanted to share with you, we do have quite a few implementation resources, and these can be found on our Choose Health LA website, which I have the information up in my last slide. But I want to close by saying, you know, there is significant evidence, you know, emerging evidence and early outcomes that adopting and implementing nutrition standards and healthy food procurement practices can assist in, you know, increasing the availability of healthier food choices. We know that, you know, this may positively influence dietary choices among adults and kids, long-term increased demand for healthier food, long-term changes in the food supply and production. And, you know, here in the Department of Public Health, we really feel like government really that we need to model healthier food environments. And, you know, and we're looking to other stakeholders and the private industry to follow suit. So I want to thank CCPHA again for inviting me today. You know, this work would not be possible without our leadership and our division, Dr. Paul Simon, Dr. Tony Kuo, our CTG Director, Michael Lays, and then our evaluation and policy team, Brenda Robles, Patty Cummings, Ali Miller, and Christine Montes. And here is my contact information and our website where you, actually the resources I mentioned to you are not on our website yet, so just stay tuned. They should be on there in the next couple weeks. But I wanted to give you this slide so you could check back in a few weeks. And feel free to give me a ring. I am more than happy to provide technical assistance with other communities and counties around California and even nationally if folks on the call are from, we have any national stakeholders. Thank you so much.